Hello everyone, welcome back. Hope you are in good health and scaling new heights in your career. Today, we are going to talk about a class of antidiabetic drugs that are not only good at their day job of lowering blood sugar but also seem to have a few delightful side hustles. We are talking about the DPP-4 inhibitors. You know, the ones with names that sound like they could be characters in a sci-fi movie like alogliptin, saxagliptin, linagliptin, sitagliptin, vildagliptin, and the ever-so-punctual trelagliptin.
Now, you might think these drugs are just focused on keeping your sugar levels in check, but oh no. They're like that overachieving friend who's good at everything. Let's start with the cardiovascular system. It seems our DPP-4 inhibitors have a soft spot for your heart. They've shown potential in managing heart failure, like a motivational speaker boosting your heart's function. Think of them as giving your heart a little pep talk. They can also help your blood vessels relax and be less grumpy, improving what we call endothelial function. Plus, some studies suggest they can even politely ask high blood pressure to take a chill to reduce the risk of those pesky cardiovascular events. Who knew a diabetes drug could be such a sweetheart?
But wait, there's more. They even dabble in lipid metabolism. Clinical studies have hinted that these inhibitors can help tidy your cholesterol and triglyceride levels, like Japanese author Little Marie Kondo's For Your Blood Fats. They seem to say, does this excess cholesterol spark joy? No. Then it's gone. And the best part? They generally leave good cholesterol, HDL, alone. How considerate these DPP-4 inhibitors are.
Now, let's talk about your amazing kidneys. The renal system might just have a new best friend in DPP-4 inhibitors. They may offer some kidney protection, possibly by improving blood flow to these vital organs and politely asking excess protein called albuminuria to take a hike means go away in our diabetic patients. They've even been linked to better outcomes for those dealing with diabetic nephropathy. It's like having a tiny security guard for your kidneys.
The endocrine system, the boss of our hormones. Here, DPP-4 inhibitors really shine. They don't just indirectly help insulin by boosting GLP-1, they seem to have a direct positive influence on our insulin-producing beta cells. Of it as giving those beta cells a spa day and a motivational speech. They can improve markers of beta cell function, which is fantastic news for both type 2 diabetes and even some forms of autoimmune diabetes like latent autoimmune diabetes in adults, also known as LADA. They might even help those beta cells regenerate and survive, protecting them from the toxic effects of too much sugar and fat. It's like giving your pancreas a little hug.
Now, for something many of us appreciate, the metabolic effects, specifically weight neutrality. Unlike some other diabetes medications that might encourage you to embrace a few extra pounds, DPP-4 inhibitors are generally weight neutral. They're like that sensible friend who suggests a healthy salad, not the extra-large pizza. This makes them a great option for folk already doing the weight-watching tango.
They're not done yet. These clever drugs also seem to have a calming effect on inflammation in the body. By potentially reducing inflammation markers and improving that important endothelial function again, they might help prevent those sneaky microvascular complications that diabetes can sometimes bring.
And hold on to your hats. because emerging research is hinting at potential neuroprotective effects. Yes, your brain might also benefit. Some studies suggest that DPP-4 inhibitors could potentially reduce the risk of neurodegenerative diseases. It's like they're giving your brain a little extra layer of protection as you navigate the complexities of life.
Last but not least, let's talk about bone health. Believe it or not, some studies indicate that DPP-4 inhibitors might positively influence bone metabolism, potentially reducing the risk of fractures in our diabetic patients. It's like they're giving your bones a little extra strength boost.
So, there you have it. DPP-4 inhibitors are not just sugar tamers, but potential allies for your heart, kidneys, metabolic balance, and maybe even your brain and bones. Of course, it's crucial to remember that these are potential benefits, and your doctor will always be the best person to decide the right treatment for you. Stay healthy and keep smiling. Thanks for watching, take care, and have a wonderful day ahead.